class we talked a lot about the injustice of race, but we also learned that injustices can be found in lots of different parts of life. And since we're all nursing majors, we decided to focus and go kind of a health route and focus on the injustice or differences in socioeconomic status and how that affects nutrition and overall health.
We decided to interview members of the Bethel community, including both students and faculty, to hear their voices on what they thought on these issues.
The first question we asked people was, how do you think nutrition impacts health?
I think it really impacts health a lot because based on nutrition and how many nutrients you're getting and from what sources, that depends on how healthy you are in terms of both your plants and greens and also your meats. If you don't have any meats, you lack certain vitamins and certain nutrients that you wouldn't get unless you ate just those. So, yep.
I think nutrition has a big impact on health. If you're eating healthy, it helps your immune system fight off infection and helps you.
The next question we asked was, what do you think is the biggest health problem impacting people affected by poverty?
Clean water.
Lack of resources.
Malnutrition.
Obesity.
I think in America one of them would be obesity because people have to buy food that isn't as good for them, and so their bodies don't get the nutrition that they need.
I think that the biggest health issue is probably the lack of access to health care or just the way that the system works. I think it probably tends to exclude people who are experiencing poverty.
So some of the biggest health problems that I would guess people in poverty have are either one, obesity, simply because a lot of the healthy food and fresh fruit and stuff is a lot more expensive than the junk food. You can buy food that's really bad for you for very cheap. Something else I would think is that your healthcare is pretty low, so you wouldn't be able to afford shots and stuff like that.
The third question we asked was, how does socioeconomic status and wealth affect health?
Healthier people are able to afford healthier foods and buy healthier foods at the grocery store, such as organic or higher quality fresh produce, as opposed to less wealthy families aren't able to buy those kind of foods, and they'll generally buy cheaper, more packaged, go out to more fast food places instead of nicer restaurants, which might serve healthier options. They also have access to healthier or nicer exercise, health clubs, fitness clubs, stuff like that, versus lower class individuals usually can't afford a gym membership, which overall discourages exercise, and they also, you could assume that they would be working more, and that also takes away from time to be able to exercise or shop for healthier foods. Generally, lower class also has more stress, and so that definitely plays a really big impact on your health, physically and mentally.
Okay. For our final question, we asked nursing professors, in your clinical experience, how have you seen poverty affect nutrition and health?
Yeah, I can think of oftentimes families that live in areas of poverty. There aren't good grocery stores that are accessible and affordable, so there may be convenience stores, and what they have are foods that are unhealthy. They may be cheap, lots of calories, and pop and chips and things, but they're not healthy for anybody, and especially kids. And so kids may be eating excess calories and be gaining too much weight, but aren't getting good nutrition.
Right.
So that can be a problem. So those are called food deserts, where there are not good sources of nutritional foods in often the inner city poverty areas.
And have you seen any specific diseases or anything that have to go with poor nutrition?
Probably the most common is anemia, with so low blood hemoglobin. Kids aren't getting enough iron in their diet.
Okay.
So that would be the most common one.
All right. And then, I guess, how do you think nutrition impacts health overall?
how nutrition impacts health. Well, it's very important. If you don't have good nutrition overall, especially children are not going to grow and develop appropriately. They may either be underweight and not be growing according to their growth curves, or they may be obese and overweight with poor nutritional status if they aren't able to build good protein and muscles and low calcium. They don't get good bone development.
Great. Well, thank you so much.
Where I work up at North Metro Pediatrics in Coon Rapids, we service clients that are low income, and some of them come from places where they don't have good access to grocery stores, and so their ability to buy a wide range of nutritious foods is lacking. So they tend to eat fast foods a lot, and their diet's not always very good. So that'd be one example.
And what health illnesses have you seen because of that?
Well, we're seeing child obesity up there. I had a little kid that was had a BMI of about 30.
Wow.
So this little guy was about as wide as he was tall, and his family just didn't understand that you can't keep eating fast foods, but knows in his mouth all the time that he eat good nutritious foods. So child obesity is a problem, and it even becomes a problem when you go to prescribe medications. Like I'm a nurse practitioner, so you go into your height by weight and dose by weight, and the weight is so big they could get an adult dose when their body's not really ready to take that. So you have to be careful on somebody who's really large not to overdose them on antibiotics. So that's another little outcome. That's a problem.
Do you have any other questions?
This project really opened up our eyes to the different problems affecting people in our own community, and it was really interesting hearing the different perspectives from nursing faculty versus students versus friends, between genders and ages, and so we're hoping that through this experience we all have a better understanding.